Well, hello, everybody. Welcome to another exciting session of Aviation 176. So, looking at our areas that we still want to be covering yet this semester, we are on module number 31. So, if you want to open up your workbook, you can look at the quiz questions at the end. Um, Now, in Module 31, up at the front section, there is a wealth of a lot of material that you are going to be able to use in your future on being able to either fine tune an existing safety and health program or to, if you go into a brand new corporation or a new company, um, it'll be really good, even from starting from scratch. Okay, so here we are, Module 31, Safety and Health Program. I did give a link here for you to go directly to the OSHA, right? So OSHA is an entity underneath the Department of Labor. So some good, useful resources for you to help you develop or fine tune the program. And this is another really, really nice guide. Again, from OSHA, gave you the link, or you could, even just do a nice little Google search. Here, I'll just drag it over, kind of show you what we're talking about. So it's about a 40-page document. Um, Nice thing, So intro, management, leadership, the importance of that, how the workers have to participate to make the program a success. A little bit about hazard identification, hazard prevention and control, the education and training portion of it. How do you evaluate the program? Make sure it's doing what you think it's going to do. How do you communicate top down, bottom up? And a list of abbreviation and terms, so on and so forth. Right? So again, a nice little guide for you. 9 easy things to get your program started, right? When you look at materials like this, you can reverse engineer it, I guess. That is one way of doing it. So if OSHA comes to town and they're giving you an inspection, and OSHA thinks that your safety program is not what they are expecting, it would be material like this that OSHA would be using as a guide to critique your program. Number one, they're going to ask you if you have this guide, and then they're going to ask you if you've read it. All right. So, a lot of times they'll just kind of march down the list. Okay, can you show me on how your guy at the top has made safety a top priority? Can you show me how supervision leads by example? Can you show me how you have implemented a reporting system? Can you show me your training? Right. So that is how I would like for you to use these materials, because the materials are out there, right? I just backed up a slide. Here's more materials that are out there. So OSHA is expecting that you are trained, that you know what you're doing, and that you know what OSHA recommends that you do. So that's how to use it. And again, the links are up here to help you a little bit on getting this stuff. All right. So the general guidelines, and you notice here the little colored box here. So that might be good to look at for your questions, for your workbook questions. So when you look at construction sites, OSHA thinks of construction as a pretty high risk area to begin with. There's an awful lot going on, and um, even when you're looking at what's going on here, right? You can see you have areas cordoned off. That's probably because there's a hazard in there, probably maybe a hole. Here you have a whole bunch of struck by hazards, cut hazards, right? Powered industrial trucks, excavation, you have silica dust, you have hard hats, you have PPE requirements. So all of these things are going on all at the same time under construction sites. So construction sites tends to get a lot of interest from OSHA, right? So here's what they're looking for. They're looking for that you really do use the OSHA's recommended practices, and that you're proactive, right? You don't wait for an accident. You are looking at the hazards, you're looking at the risks ahead of times, right? So that's really the guidelines here. And so this is the source document for that, is that little guide that I just showed you. Okay, so why? Why should we have a good safety and health program? Right? So here are here's the top 4 reasons that OSHA puts out. Right? So it's going to make you a better company. It's going to help your morale, or if you flip it around the other way, by having accidents, having people losing an arm or a leg, or people losing an eye, or worse yet, getting killed on the job, really bad for morale, right? Hard to attract quality people, right? So if a lot of people are getting hurt, they're just going to find another job. And your reputation can be a very, very important thing, right? Look at what is happening to Boeing right now with the Boeing 737 MAX, right? So the image of Boeing right now is the most tarnished that I've ever seen it in my lifetime. And additionally, the FAA, their reputation is extremely tarnished, right? So it takes years and years and years to work on a favorable image and a favorable reputation, and it doesn't take long to lose that. The core elements. So here are the core elements that we are going to look at. If anybody has taken SMS, Aviation 311, you can see that a lot of the principles that we have in SMS are here also within OSHA. Okay, so these OSHA rules were put into place probably decades before the FAA decided to implement safety management systems. So you can see that they're the same, but they're packaged a little bit differently. Okay, so here are the core elements. Of course, you have to have leadership from the top. That safety is number one, that we're not going to cut corners. The workers have to participate. So if the company buys PPE, the workers actually have to wear the PPE. Proactively, you look at hazards, you identify them, you assess them, and then you try to control your hazards, you try to prevent them. You have to get the word out, you have to educate everybody, because what good is it? Like, say if you buy a brand new piece of PPE, but you don't educate people on you have the PPE or what it does, right? And you have to evaluate your programs. Is it doing what you think it's going to do? Were there unintended consequences? Are there areas for improvement? And then also the multi-employer work sites. So how to coordinate between those. Say for UND, our challenge is also, say, communicating with our Grand Forks site, with our Phoenix site, right? So we have had, this is unrelated, but yet it's related, talking about multi-employer work sites. So multi-work sites. At Grand Forks, we were looking at the flying in mountainous terrain and looking at risk assessments on flying in mountainous terrain. And, and at Grand Forks, we thought, don't have an awful lot of mountainous terrain here in North Dakota. So maybe we should tune this thing down. Well, we pretty much just eliminated it. And about a year later, the people in Phoenix said, hey, we're getting ready to do some pre-briefs on mountainous terrain, and hey, where did the guidance go? Then Grand Forks said, well, we don't have any mountainous terrain, so we got rid of it. And then Phoenix said, well, we have a lot of mountainous terrain. Would have been nice if you would have coordinated that deletion with us. So that happens all the time also, in the ground community within OSHA. How do you make sure that you communicate to your different sites and with, say, temporary employees, permanent employees, things like that. So within your workbook, it's just awesome. 9 easy things to get your program started, right? And then it has the core elements. So really good, really good handout. And if you want to pause right now and open it up and kind of page through it, that would be a good idea. Or to open up that OSHA guide too. And you can just pause the video and then look through it and then restart when you're ready. Okay, so here we go. So the way that OSHA puts it out is we're going to march right through these things with goals, milestones, how to pull them off, right? So when you talk about leadership within management, right? So if management is going to lead from the top, right, you're going to have top-down communication, bottom up. You got to walk the walk, you got to talk the talk. So management needs to be the big player, where safety is cool. One accident is too many. One injury is too many, kind of a deal. So how are we going to pull that off? So here are a whole bunch of sub-bullets that are listed. And again, probably going through this guide would be the best way to do this. But you have to have a written policy, right? Because the written policy, it's going to be looked at, it's going to be communicated with all of the process owners and all the stakeholders in there. And then when you get the policy, of course, you're going to have to communicate it so everybody knows about it. You're going to have to do goals. Are you going to have a goal of 0 mishaps? Or are you going to say, well, if we kill 5 people today, that's going to be okay, right? Are we going to say, okay, let's take this metric and then let's put her down by 10% every year? When you are looking at program goals, you're going to look at metrics, you're going to look at time frames, and you'll come up with goals with metrics that are leading indicators. You'll look at some that are trailing indicators. So say if we're going to look back at the COVID-19 pandemic, the number of deaths due to COVID-19, that would be a trailing indicator, right? So a leading indicator would be the percentage of the population that's testing positive. That would be the first leading indicator. And then once you get more and more positives, then that means you'll have more and more people that eventually get put into the hospital. And then you will eventually have more and more people that are going to die. So when you're looking at your goals, you're gonna have to track your goals. You're going to come up with leading indicators, and you're going to also have trailing indicators. So for OSHA, the big trailing indicator would be how many people died, how many people are dying on the job, right? And then the leading indicator would be, say, if you have an anonymous way of reporting hazards out there, that would be a leading indicator. We have more and more people saying that when we drive a truck without the backup horn working, that boy, we almost hurt somebody. We almost killed somebody, but we didn't. Nobody got hurt. Nobody got killed. So those reports, those safety reports, make them anonymous so that you can get the data. And those would be leading indicators, or we call them near misses in OSHA. Okay, and then management, they are the people that allocate the resources, right? Management controls the money. Management controls how many people are going to be hired. And management also is the one who is going to expect performance, right? So you're going to track the numbers and, and when the numbers go one way, then that's when people will be rewarded. And when they go the wrong way, then we dive in, we do a deep dive, and we figure out why. Okay, so worker participation, of course, the workers have to know the rules and they got to follow the rules. And we don't ever want a worker to have to choose between keeping their job or doing the safe thing. Right? So again, for the worker participation, we really need the workers to participate. We need to have a culture where they do, where it's just the way that we do business. We encourage the workers to report any concerns that they have because these would be leading indicators. And if we can attack the leading indicators, ultimately we can control the number of people that are hurt and the number of people that are killed. Okay, and then we have a hazard identification and assessment, right? So again, this is proactive. Let's look before people get hurt. Let's find out where the hazards are. Let's assess them. And that's what we're doing. And a good part about this is we want to be proactive. I'm going to back up a slide, okay? So we want to be proactive under our hazard identification and assessment, but there will always, always, always be a reactive format where we do have an accident, right? Because nothing is perfect. Just like for y'all that have taken 311, safety management systems. We do our very, very best to be proactive to make sure that an accident never happens, but nothing is perfect. When we do have an incident, when we do have an accident, we have to throw the proper time, money, and resources into it so that it never ever happens again. We got to find out what the root cause is, and we have to communicate that to our people, right? So under hazard identification and assessment, there is this part where we do investigate the close calls, the near misses, and the accidents, the incidents, and then find out what the root cause is. Okay, so action item 1. So how do you identify your control options, right? So yeah, you look at what is the likelihood, you look at what is the severity, you look at what can you do to lower the likelihood, what can you do to lower the severity. So say if you have a forklift and you have a seatbelt on it. So you think about operating a seatbelt or operating a forklift with a seatbelt, or you look at operating a forklift without a seatbelt. So this putting on the seatbelt does not lower the likelihood of having an accident, but putting on a seatbelt will lower the severity of the accident, right? So instead of getting thrown out of the forklift and then the forklift rolls over and crushes the worker, the seatbelt will keep you in the seat. So it'll lower the severity, but it doesn't lower the likelihood, right? So then you select your controls. What are you going to do to lower the likelihood of a bad event? What are you going to do to lower the severity? And we hit this big time, I think, under the first week. I tried to blow this up, and this part over here worked out pretty good. But this stuff here got a little fuzzy. Hopefully you can still read it. But when we look at how to lower the risk, we start up here. You try to eliminate the hazard. Then if that doesn't work, then you try to replace the hazard. And then you do the engineering controls. And then after that, you do administrative controls. And then last but not least, after you do all 4 of these things, if you still need more control, then you add in the PPE. Okay, so we talked about that in week 1, so I don't want to pile on here, but a good little review and a good little reminder that you just don't go to PPE number 1, you actually go to PPE number 5, right? And when OSHA comes to town, that is what they're going to be looking at. Why didn't you try to physically remove the hazard first? Why didn't you replace the hazard second? Why didn't you isolate people? Why do you have everybody in that dangerous spot? Right, like on that picture that I was showing you with the backhoe digger. Why do you have 20 people in the area of that backhoe that's swinging around? You should just have the number of people that have to be there. Okay. So then you select the controls, and a really cool thing too is when you have an emergency, when you have a non-routine event that happens, you got to train people for it. So say if say you're in a construction site and you're inside, and say a fire develops. Well, some of your people, in fact, most of your people, what you're going to do is you're going to train them that if there's a fire, run away. And if you see a fire alarm, pull the fire alarm as you're running away. And if you couldn't find a fire alarm, and if you have a cell phone, call 911 once you get outside in a safe place. But there are some people within your organization where when there is a fire, they run towards the fire, right? So the people that are trained to fight the fire, and they will know who they are if you do proper training. The people that are trained to fight the fire, they run towards the fire, and the people that aren't, they run away from the fire. There can be operations going on, so say if you have a load that's going up and it's coming down, there may be people that the first thing that they have to do is get that load and put it back to the ground before they run away. There may be some items that have to be shut down. Usually that has to do with electrical requirements. So before those people run away from the building, they have to make sure that everything is shut down. If you're working with hazardous chemicals, there are people that will have to make sure that they secure the hazardous chemicals. Right? So that'll be the cool item about that. So you find out what are you going to do during emergencies, non-routine operations. Basically, who needs to stick around to put things under control, who just needs to run away, kind of a deal. And then again, you implement your controls according to your priorities. And ultimately, you need to follow up and make sure that they're effective, right? So you will do tests, you'll go back, look through historical numbers and make sure that your risk mitigations really are working and that you're not creating unintended consequences. All right, so like right now, something interesting that I cannot wait to see, and it's going to be many years, will be the COVID-19, where it's like, okay, we don't want people to get sick, so we're going to tell everybody to go home, shelter in place, which means we're going to shut down all these companies. Now everybody's going to shut up inside your house. So is that an unintended consequence, right? It's really hard to say that, man, let's stop the pandemic. Let's put everybody into your house for a month and let's get this thing under control. But we also have to look at not only the loss of lives, but the loss of livelihood, the unintended consequences. So if somebody was a alcoholic or they start abusing drugs, or they start abusing their spouse, or you have psychological suicides, children that aren't in school, that were getting food, that were getting free food every day. That was how they got at least one nutritious meal. So that's where this follow-up is really important, because sometimes the cure can be worse than the disease itself. And that's what you're looking for. Unintended consequences. Did it really, really, really work? Okay. And education and training, right? So just like it sounds, people have to be trained. It has to be promoted, right? And here's all the ways that you can do that. Okay. And when you verify that everything's working, how often do you do it? By and large, when you first make your plan, you want to start verifying that it's doing it. And most companies do annual reviews, right? OSHA will really work with you under this. If you create a company policy that we're going to review this thing initially, and then we're going to do a cursory annual, and then every other year we're going to do a huge reevaluation. OSHA will work with you, and then they'll really want to make sure that you do what you say you're going to do. Or, maybe you want to do it every 6 months. So if you put down in a policy that you will evaluate the effectiveness of your safety and health programs every 6 months, and if you write that down, that's what OSHA is going to hold you to. Okay. And then when you see shortcomings, they want you to fix it. Okay. Communication, effective communication, top down, bottom up. Yeah, and that is pretty much it. Pretty straightforward. Get out the guide, and that'll really help you through it. Ultimately, this is how OSHA will be expecting you to run your program. Okay, so it'll be a very, very good, very good way to put you on the good side of OSHA. Okay, so good luck with the quiz questions.